Kia ora katoa, ko Martin Chadwick aho. I'm the Chief Allied Health Professions Officer here at Manatū Hauora, the Ministry of Health. I just want to take a couple of minutes, if I could, and just talk to you about the journey that we've been on within Manatū Hauora around how we start to really think about who we are within the context of Aotearoa New Zealand. And we've been in the process of looking about how we name ourselves and name the parts of the ministry. And say Manatū Hauora is the Ministry of Health, that is who we are. But then I get to work with my clinical colleagues, I get to work with the Chief Medical Officer and the Chief Nursing Officer. And so one of the key changes in how we're naming ourselves is that we're naming ourselves as Ngā Api Hauora. So the clinical chiefs, roughly what it translates to. But then there's always a thing around allied health, because allied health is a term that we've inherited and it's got a rich history, but it's a history that we've adopted within New Zealand, and it's a history which is really focused on leadership. So how do we provide leadership for the professions that are not nursing, not medicine, not midwifery and dentistry? And so within the ministry, what we've done is really take the time to think about how do we articulate a term, a name for us that I can start to use within my role, which more accurately reflects who we are and the cohesiveness and just the pure necessity of the professional group, which is allied health. So what you're going to see from me now on is that when I start to talk about allied health is I'm going to start using the term Hauora Haumi. Now, to talk about the term itself, so Haumi, when it's translated, roughly means alliance, ally, and to join. But it also has got a very rich meaning insofar as that Haumi is what is used within the making of a waka. It's made to join the waka together. And I think that's really important because that describes the critical nature of allied health, is that we bind together. We're critical and integral to part of the services that we provide within the New Zealand health system. It's also a term that is used to describe what a master carver would often do if they were extending a waka. They would add a Haumi to allow the waka to be bigger. And I think that's a really nice analogy to use, that by having the waka big enough with allied health, it allows us to take more people on the journey towards a concept of pai ora, or wellness for all. So I wanted to share that with you today because that's what I'm going to start using as a term within Manatū Hauora to describe the amazing group of people and professions I get to work with every day, which is Hauora Haumi, allied health. So October 14th is our day. That's the day that we get to celebrate allied health professionals. So I just wanted to acknowledge that and say the term that I'm going to start using from now on within my role, Hauora Haumi, to describe the integral nature of who we are in providing the services to Aotearoa New Zealand. Kia ora.